I need to make a sort of announcement. I'm not an expert in community response in hepatitis C treatment access. However, I've been tasked to give this talk, and I'll do my best. I will be short and sweet, and the reason for this is I understand you've had a lot of words already, and as you will see, I'll provide pictures. So, first of all, I'll give you a very short overview of the community response in Asia, and then I will attempt to provide an insight of this response with 4 pictures, and then round up with some next steps towards HCV treatment for all. We've been learning about, we are learning on HCV treatment access by mobilizing for HIV treatment in the past 20 years. So this is not new for us. However, it is really difficult because there is a war against drugs in the Philippines, in Indonesia, and a lot of Southeast Asian countries, and increasingly with more, it looks like you have a lot more US support with the war against drugs now under Trump, and that makes it more difficult for us to mount an effective grassroots response because people are afraid. However, we are reaching out beyond just community. We are reaching out to our partners in academia. We're reaching out to our partners in legal and justice organizations. And we're reaching out to our partners in multilateral organizations in the UN and international NGOs. We are using all our experience in HIV in uniting in diversity for the right to health. So we've been here before. This picture is in New Delhi in 2011, and is a tribute to the success of the Asia-Pacific network of people living with HIV to mobilize in fighting for treatment access to HIV in this region. And with grassroots mobilization, we have been able to galvanize and nurture people living with HIV in Southeast Asian countries and also in South Asia to understand their needs, to fight against treatment access with local governments, and to understand what are the barriers impeding this access. And we're able to mobilize in great numbers. And this tells you that with HCV, they are not alone, we are not alone. We are all in this together. So it's about the right to health. Health is not for sale. And this is a group of women in Manipur in India in 2010. And it shows you that the mobilization in country level is going down right to the grassroots to people affected by HIV and now increasingly with HCV, especially with co-infection, because HIV and HCV co-infection affects people most vulnerable to both diseases. And in fighting for the right to health, like I said, we're reaching beyond just a community network. And one of the recent challenges that we've been mounting is part of the Initiative for Medicines, Access and Knowledge, APACC. And that has started a legal action against Gilead in China for sofosbuvir. So this tells you that things are not totally status quo. We're not keeping silent, or we're not working in silos. We're beginning to work together, we're beginning to unite, and we're beginning to mobilize. And this is what you've heard with Gitan's presentation, and rightly so. Oops. So, we can end HCV. And as Margaret has said, elimination is possible because the drugs are available. In 3 months, people can cure HCV with current medication. We must not leave this community behind. If anything we've learned from HIV, governments very conveniently will leave people most at risk, most vulnerable because they have no voice. At the international fora like this one, and when you go back to your countries, wherever you are, I hope you will link and you will mobilize and you will help us. Please make it known to your friends if they are at risk for HCV that there is a cure. Get tested and treated. And whatever it takes. As Gitan has mentioned, there are Buyers Club. We run a multi-pronged Buyers Club in the Asia-Pacific region under APN+. This is my tranche. I won't tell you where it's from. I probably can make it out. But so we have community members traveling all over the region, and we are helping people get access to treatment. If you are in need of treatment, treatment can be available for as low as $1,000 and sometimes even lower because we as community are paying for each other. Those of us who cannot afford it are getting it for free, and those who can afford it are paying for those who cannot. The community is mobilizing. We are not going to leave people behind. And this subsidizing effort within the community tells us that we are serious, and we have learned through much hardship that if you leave people behind and you leave people out of the loop, we are all going to suffer. So what is the next steps? The next steps is we must focus on people and not patents. We are working together with many organizations in order to push this effort in including legal means. And I want to pay tribute to the person who is spearheading this in our region, and he's Shiba. He's pictured here. Shiba is the regional coordinator of the Asia-Pacific Network of People Living with HIV. He cannot be here today, but he has been working tirelessly, including treating with his own medication for HCV people who cannot afford it and leaving himself out until his friends are all treated. This kind of selflessness, this kind of activism is alive in Asia today. He has been called to the UN high-level panel on access to medicines, and we are very proud of him. And he has been the leader on many people, including myself, in galvanizing the response and in making sure that we are all in this together and nobody's left behind. Thank you very much.